Hey group, how you going? My name's Luke and I haven't posted much in the group, so I figured I'd make this first video to sort of introduce myself and also to kind of ask you guys a bunch of questions. So for starters, my name's Luke. I live in Sydney, Australia. I live just in the kind of North Sydney area. I'm new to my diagnosis with adult ADHD. I also have a compounding mental health diagnosis with schizoaffective bipolar mood disorder. I've managed my bipolar mood disorder for some years now without any acute episodic admissions to hospitals or anything like that. And I largely think I'm pretty good at self-observing the symptoms of bipolar type 2 without much need to sort of remind myself that I have a mood disorder. And I think recently, after exploring both the symptoms and the side effects of being in treatment for adult ADHD, that I've discovered and unpacked some new facilities. And namely, I think that's to do with patience, number one. Number two, like raging. Number three, my ability to actually articulate, focus, and complete something like this simple video. And I want to pose this group or anyone watching this question, and that is, by nature, do you think people who are experiencers of ADD and adult ADHD, and even children, do you think they're by any chance lent more prevalently to high creative output and potential? Because I've got a feeling that could be the case. It's like when I observe closely my bipolar brethren, I don't think that's nearly as obvious. And the suggestion is that ADD and its surrounding diagnosis may lend experiences of those diagnoses to more creative output and potential. And I think what is the most difficult as an artist and also as someone who's in treatment for ADD is to like my own creative work, to finish my creative work, and then to exhibit my creative works in the context that they are designed. And I'm a musician. I grew up playing the drums. I also now play many other devices, and I'll just pick up the camera here. Sorry if it makes all these awful noises, but I'm trying to avoid the microphone. I play this device. It's called a push, but I also play, you can see the keyboard there. There's a drum kit back there. I DJ sometimes on this thing, and generally, like, if it makes a sound, I can like mess with it until I like the sound that it makes. There we go. And I think, oh God, I look so horrible. Oh man, I look like I just got out of bed. Oh shit. I just want to throw that at you, group. Like, tell me what you think. Like, are you creative? Like, do you draw? Do you sew? Do you? And it doesn't have to be a creative thing, actually. Like, I guess the question here is, have you got a hobby? Is there something you're really good at? I find us ADD people, we can be like really good at stuff. And the more people I meet who relate to me in relation to being in treatment with ADD, the more I am just inclined to ask, like, what's your hobby? What's your passion? Are you creative? Are you good at something? And it's always a long answer for the ADD people, which I love because it gives me insight. And without insight, I guess we wouldn't have what we have when we submit to treatment. So on that note, see you all later, and I'd love to read your comments. Bye-bye.